Hi everyone, Dr. Gettings here. Today we're going to go over some of our frequently asked questions that we get regarding taking care of your child's teeth. So the first question that we get is, what do I use to brush my child's teeth? So before your kid has teeth when they're a baby, you can use a soft bristled infant toothbrush, or you can use a clean cloth, just kind of, clean the gums. Whenever they get their first tooth is when you want to start using a soft bristled toothbrush and fluoride toothpaste. Okay, so this is the toothbrush that I use for my son Oliver. You can see it's got a small brush head there and soft bristles, and so that's the one that I use. And then the toothpaste that we use here is Crest. As long as it says fluoride on the tube, then it's good. They usually have good flavors for the kids. Sometimes training toothpaste does not have fluoride, and so you just want to make sure that it says that it has the fluoride in it. And so for a kid that's under 2, you can use a right-size smear of toothpaste on the toothbrush. And from age 3 to 6, you can use a pea-sized amount. So any child under 6, we want mom and dad to be helping out with brushing. They're not really able to effectively brush on their own. And you want to make sure that you're brushing twice a day, right after breakfast and before bedtime. The next question that we get a lot is about thumb sucking. Is it okay if a kid sucks their thumb or their fingers, or if they use a pacifier? So I get this question all the time. My son is 1, and he likes to suck on his fingers, and people always say, are you worried about that? The short answer there is no. Many kids do this to self-soothe. So what you want to do is make sure that they naturally kind of let go of that habit. It's a little bit easier if it's a pacifier and you can take it away from them. But we're not really concerned until about age 3. And so if it's something that's still going on, you want to let your dentist know. The concern there is that when the front teeth come in, they can have problems if they're still sucking on their thumb. The next question that we get a lot is when to bring your child to the dentist. And so we recommend, and the American Academy of Pediatric Dentists recommend, that you bring your child in for their first visit around age 1. And so the reason for that is so that, they are there at a young age. We can help you with daily routine with brushing. We can go over the child's diet and making sure that we're keeping sugary things out of the diet. And then the next question we get a lot is how often. We want to see the child every 6 months, just like an adult. And the reason for that is cavity prevention. And also so we can kind of go over those brushing techniques with the parent and the child and make sure that things are getting done effectively. The last thing I'll go over is flossing. So if your child has 2 teeth that are touching, you want to make sure that you've got those teeth flossed. A lot of times kids like to use the little floss picks. They have Disney characters on them and things like that. So I think that's always a good idea. And like I said, that's really whenever your child starts to have teeth that are touching. So hope this was helpful. I hope this finds you healthy and spending some time with your family. I look forward to seeing all of you back in the office whenever we're able. All right, bye.